Hey guys, welcome back to my channel. Today we are going to see about the landmarks seen in the maxillary as well as the mandible. In the IOPA, IOPA is nothing but intraoral periapical radiograph. We have already discussed this in detail in 3 parts. You can refer the channel for that videos. Today we are going to do a very crisp and summarized version of the following. So, to know the basics, the radio opacity is nothing but a white structure. How it appears white? It appears due to the white of the calcium. To remember it, I am telling in this way. Calcium is formed by the calcification, and as we know, calcification is mainly seen in the bones. Where it is seen? It is seen in the bones, cartilage, and our teeth or tooth. So, how it will appear? Calcified structure will appear radio opaque. O is 2 half C. So, how it will appear? Radio opaque. So, to remember how it will appear? Radio opaque. Radio opacity is nothing but white in color. How it appears? White. And radiolucency, as the name suggests, L comes in black. So, how it will appear? Black. Radiolucent structure are black structures. They are the soft tissue structures. Mainly they are the soft tissue structure. Radiolucent, how they appears? How they appear? Black or dark in color. Okay. So, this is the basic. To start with the mineralization, the content of the enamel is the most mineralized, that is 90%, then dentin 75% mineralized, then cementum 50% mineralized. As we can see here, the most white structure is the enamel, the less white structure is the dentin, the more less white structure is the cementum, and this blackish structure or dark structure is the pulp. How it appears? Radiolucent. As we can see, between this two white structure there is a black structure. How it appears? It is a pedial space. Pedial is a soft tissue, a periodontal ligament, so it will appear radiolucent or black in color. So, to start with the supporting structure, lamina dura, as the name suggests, it is nothing but a lining of the alveolar bone proper, as it is the lining of alveolar bone. So, bone appears calcified. How it will appear? Radio opaque. Radio opacity means white. So, how it will appear? Radio opaque. It is located just outside the pedial space. As we can see here, this is our radio opaque structure. The continuation, this was our periodontal space. How it appears? Radiolucent. The space just outside the pedial space is known as the lamina dura. Where it appears wide or dense? It appears wide or dense in the heavy occlusion teeth, and where it appears thin or less dense in the teeth where there is less occlusion or less function. Generalized loss of lamina dura is seen in the parathyroidism, Paget's disease, and hypophosphatism. The pedial space, as the name suggests, it is the space where the periodontal ligament is located. So, periodontal ligament is a radiolucent structure, as it is a soft tissue. So, how it will appear? Black on the radiograph. Tooth root and lamina dura, the space between them is the pedial space. How it appears? As an hourglass shape. The thickness is directly proportional to the occlusion. Absence of pedial space is seen in hypercementosis, Paget's disease, and ankylosis. Ankylosis is nothing but the fusion of the tooth and the bone. This is ankylosed tooth. This is ankylosed tooth, as there is no periodontal ligament. So, this was about the absence of pedial space. Widening of pedial space, it is very important. In the localized condition, it is seen in periapical lesions, and in generalized condition, it is seen in osteosarcoma, scleroderma, trauma from occlusion. Alveolar crest, as the name suggests, it is the part of the alveolar bone. So, how it will appear? As a radio opaque, as bone is a calcified structure. The gingival margin of the radio opaque alveolar bone that extends between the teeth, as we can see in this IOPA. These are two teeth, and this the structure. The gingival margin of the radio opaque. The gingival margin of the alveolar bone appears radio opaque. This is nothing but alveolar crest. The loss of alveolar crest, when we can say it is lost? Where there is more than 1.5 mm from CJ. As we know, enamel and cementum, the junction between them, when the loss of alveolar crest, this is normal alveolar crest, but when the loss of alveolar crest is more than 1 or 1.5 mm, so we will say the alveolar crest is lost. The cancellous bone or trabecular bone, as the name suggests, suggests, it contains trabeculae. As we can see in this structure, it is nothing but thin radio-opaque plates are seen, plates and rods, and many small radiolucent pockets or marrow is seen. Marrow is nothing but space. So as we can see here, the radio-opaque plates and rods and radiolucent marrow spaces. What we can see, radiolucent marrow spaces. This was about the supporting structure. So to start with the maxillary radiograph, the first structure we are going to see is intermaxillary suture. As the name suggests, it is a suture. It is not a bony part. It is the location between the two bones. So it will appear as a radiolucent. It is a bony joint. As we can see in this diagram, this structure, the arrow where it is showing, it is the intermaxillary suture or median suture between the right and left half of maxilla, thin line between the two portions of premaxilla. This is the anterior nasal spine. Anterior nasal spine is nothing but the continuation of intermaxillary suture. So how it will appear? It will appear as radio opaque because it is a spine. It is a part of bone. The suture was the part between the two bones. This was the suture and this is the continuation of bone. So how it will appear? It will appear as the radio opaque structure. Sharp projection of maxilla in the midline at the junction of inferior end of nasal septum and intermaxillary suture. It is a V-shaped radio-opaque area. It is located above 1.5 cm to 2 cm above the alveolar crest. As we can see here, this is the V-shaped structure. This is the V-shaped structure. This is the intermaxillary suture and this is our nasal septum. So the junction between the nasal septum and intermaxillary suture is the nasal spine. Nasal spine is also known as anterior nasal spine, intersection of nasal floor and nasal cavity. It appears as a V-shaped radio-opaque area. The next structure is the nasal cavity or nasal fossa. As the name suggests, cavity or fossa is a depression, so it will appear as radiolucent as it is a blank tissue or empty tissue or air-filled space. So it contains no bony or no calcified structure. So how it will appear? As a radiolucent. Above the oral cavity, this is our oral cavity and this is our nasal cavity. So these two are nasal cavity or nasal fossa above the oral cavity either side of nasal septum. This is the nasal septum. Large radiolucent area above the maxillary sinus, where it is located above maxillary sinus. Central incisor, lateral incisor. So above the maxillary sinus. As we can see in this diagram, this black structure nasal fossa, this white radiopaque structure nasal septum, anterior nasal spine, and this is the intermaxillary suture. Inferior concave we will see later. Median palatal suture, that was nothing but the intermaxillary or median palatine suture. Floor of nasal cavity, as the name suggests, floor. So how it will appear? It will appear as a radio-opaque band of bone above maxillary incisor, formed by the palatal process of maxilla and horizontal portion of palatine bones forming the bony walls. The nasal septum as the name suggests, it is a part of bone. So how it will appear? As a radio-opaque. And how it is located? Vertically. So this is the nasal septum. Nasal septum is the septa which divides the nose into two halves, right and left half. Nasal cavity into right nasal fossa and left nasal fossa, vertical bony wall, vertical radio-opaque partition. Inferior nasal concha, as the name suggests, inferior. There are three nasal conchae, superior, medial and inferior. Concave is nothing but a curved plates of bone. Conchae are nothing but curved plates of bone. As they are located in the nose, they are known as inferior nasal conchae. Thin curved plates of bone extends from lateral wall of nasal cavity. As we can see here, this curved bone, these two curved bone are nothing but inferior nasal conchae, from where they are coming, lateral wall of nose. This is nothing but lateral wall of nose. Diffuse radio-opaque mass. Why it is radio-opaque? As it is a continuation of bone or projections within the oral cavity. This was the inferior nasal conchae. The next is the incisive anterior or nasopalatine foramen. As the name suggests, foramen is a hole or cavity. So how it will appear? As a radiolucent area, junction of the mid-palatine and incisive sutures behind the central incisor in midline. As we can see here, this is the intermaxillary suture. Here somewhat here there will be incisive foramen. It is nothing but round or ovoid radiolucent area between roots of maxillary central incisor, where it is located between the central incisor. The next part is the soft tissue of nose. As we can see here, this the overlapping structure. The superimposed structure, soft tissue of tip of nose superimposed over roots of maxillary incisor. This is our maxillary incisor, and this superimposition slightly radio opaque with sharp borders. The borders are very sharp. You can clearly see the soft tissue of nose. The next part is the lateral or incisive fossa, as we can see in this picture. This is our central incisor, lateral incisor. Here we can see the depression, which is nothing but lateral or nasal incisive fossa. It is a depression in maxilla. So how it will appear? As a radiolucent area around the apices of lateral incisor. This is a lateral incisor, right side and left side. We will see lateral or incisive fossa near the lateral incisor. Inverted Y line of N is very important MCQ question. It is formed by the intersection of floor of nasal cavity and floor of maxillary sinus. So this is our maxillary sinus floor, and this is our floor of nasal cavity. So we can see this Y-like structure. So the straight line of Y is formed by the floor of nasal cavity, while the curved line of Y is formed by the maxillary sinus floor. It is a radio-opaque structure, as we can see. It is formed by the floor, so it is a radio-opaque structure. Upside down Y we can see an intersection of nasal fossa and anterior border of maxillary sinus. Here also we can see the curved parts of maxillary sinus. The floor of the maxillary sinus, it is paired cavities of bone located in the maxilla. As we can see clearly here, the white structure, thin radio-opaque line is the floor of maxillary sinus, passing near or crossing apices of molars. These are our premolars, and this is the molars passing through the apices. Apices means near the root apex of molars. The next structure is the maxillary sinus septa. Maxillary sinus septa is nothing but the division, the septa which divides the maxillary sinus by thin bone known as bony septa. It is a vertical line. How it looks? As a vertical from maxillary sinus, it is a thin radio-opaque line. The next structure is the zygomatic process of maxilla. As we know, maxilla has many processes like palatal process, zygomatic process. So this is the zygomatic process. Apices of first and second molar, the root of first and second molar. So here it is located. This is the zygomatic process of maxilla. Extension of lateral maxillary surface which articulates with the zygomatic bone. How it appears? J or U shape. This is our J and this is our U. The opening is towards the upper surface. J or U shaped radio-opacity. How it will appear? J or U shaped radio-opacity, as it is a bony structure located at the apices of first maxillary molar. Open end is situated superiorly. The next part is the zygoma, also known as cheekbone, molar bone or zygomatic bone. It is nothing but zygoma articulates with the zygomatic process of maxilla. This was the zygomatic process. So and this is our zygoma. Diffuse radio opaque band extending posteriorly from zygomatic process of maxilla. This was our J-shaped or U-shaped structure. So it is located posterior. Posterior to the zygomatic process of maxilla. The next part is the maxillary tuberosity. As we can clearly see the elevation, so it is known as tuberosity. Clearly see the elevation, how it will appear: radio-opaque bulge, distal or backward to third molar region. Rounded prominence of bone extends posterior to the third molar region. The next structure is pterygoid plate. As we know, medial pterygoid and lateral pterygoid. It is nothing but sphenoid bones. Continuation is medial pterygoid plate and lateral pterygoid plate. The medial pterygoid plate gives rise to a structure called as hamulus. We will see later. The medial pterygoid plate or lateral pterygoid plate are nothing but they are located immediately posterior to the tuberosity of maxilla. Immediately posterior to the tuberosity of maxilla. As it is a bony structure, it appears radio-opaque. How it appears? Radio-opaque, homogeneous shadow, no evidence of trabeculation. No trabeculation is seen, as we have seen earlier, that is cancellous bone is not seen in the pterygoid plate. The hamulus is nothing but hamular process, which is a small hook-like projection. As we can see, it is nothing but a small hook-like projection. It comes from medial pterygoid plate. As we have seen earlier, medial pterygoid plate was the part of sphenoid bone. It is a radio-opaque hook-like projection posterior to the maxillary tuberosity area. These are maxillary tuberosity, and this is the hook-like structure. So this was the structure seen in maxilla. While in the mandible, There are 17 structures we saw in the maxilla and 4 supporting structures which are seen in both maxilla and mandible. Now we are going to see 2 structures of the mandible. The first structure is the genial tubercle. Tubercle means the elevation or mental spine. It is located on the lingual surface of mandible above the inferior border of midline. It is a bony protuberance, more or less spine shaped. It is right superior, left superior, right inferior and left inferior. Okay, so this radio opaque mass is nothing but genial tubercle. Radio opaque mass be in midline below the central incisor roots. So this structure is genial tubercle. Lingual foramen. Lingual foramen is nothing but these are the 4 genial tubercle. This is the lingual foramen, as the name suggests, foramen. So how it will appear as a radiolucent structure. Tiny opening in the bone, lingual surface of mandible near midline, surrounded by the genial tubercles. And this is the lingual foramen, small radiolucent dot surrounded by radio-opaque ring, which is formed by the genial tubercles, inferior to the apices or apex of the mandibular incisor, inferior to the apex of the mandibular incisors. The mental ridge, as we can see in this diagram, it appears as an inverted V shape, linear prominence of cortical bone seen on the external surface of anterior surface of mandible in the premolar region to midline. This is our midline and it extends towards the premolar region. Slopes slightly upward. It slopes slightly upward. 2 radio-opaque lines seen bilaterally. As we can see, 2 radio-opaque lines we can see bilaterally, forward and upward. It is going forward as well as upward towards the midline. This is our midline, so it is going forward and upward. Inverted V shaped in manner. The usual V is like this, but they are appearing like this, so inverted V shaped in manner. The next structure is the mental fossa. As the name suggests, fossa means radiolucent area. It is nothing but depressed area of bone seen on the labial aspect of mandible, laterally from midline and above the mental ridge. This was our mental ridge. It is located above and laterally from midline and above the mental ridge. It appears as a radiolucent area above the mental ridge. The next structure is nothing but the lower border of mandible. How it will appear? It is a part of mandibular bony structure, so it will appear as radio-opaque band. Here we can see the mental foramen. The one thing to note, it is located on the external surface of mandible on the region of mandibular second premolar. First premolar, second premolar के apex पे होता है. Anterior limit of inferior dental canal or inferior alveolar canal. Small ovoid or round radiolucency, as it is a foramen in the apical region of mandibular second premolar. Here we can clearly see radiolucency. That is mental foramen. The next is the nutrient canal. It is a vertical canal. How it is it is a vertical canal. As we can see here, we can see here, it is a tube-like passage through bone, contains nerves and blood vessels, supply the teeth. Radiolucent lines vertically downward from apex. Mylohyoid ridge, as the name suggests, ridge, it will appear radio-opaque. It is nothing but irregular prominence of bone. It is located on lingual surface of mandible. Point to be noted, in the area of third molar to lower border of mandible, region of chin. From third molar region, it is coming forward towards the chin, so it gives attachment for mylohyoid muscle. It is a radio-opaque band, extends downward and forward. As we saw here, it extends downward and forward as it is going towards the chin, area of third molar to premolar. Level of apices of posterior teeth, level of the apex of posterior teeth. Mandibular canal, as the name suggests, it is a tube-like passage. It will appear as radiolucent area. It will carry the inferior alveolar nerves and vessels. While it will carry inferior alveolar nerves and vessels, the 2 radio-opaque lines, as they run parallel to each other, they are known as tram lines below mylohyoid lines. The external oblique ridge is nothing but the continuation of anterior border of ramus of mandible. This is the ramus of mandible. This is the continuation. So this is known as external oblique ridge. It will appear as radio-opaque line. How it will appear? As a radio-opaque line of varying width. It is located posterior to the third molar region. The next structure is the submandibular fossa. Submandibular fossa is nothing but depression. the submandibular gland lies in this. It is located on the internal surface of mandible. As we saw, there are external and internal surface. It is located on the internal surface of mandible, inferior to the mylohyoid ridge. Mylohyoid ridge is above and submandibular fossa is below. As we can see here, this is the external oblique ridge, and this depression is the submandibular fossa. It is located below the mylohyoid ridge. It appears as a radiolucent area as it is a depression. Inferior border of mandible, as we have seen earlier, it is a broad radio-opaque band of bone. This was all about the anatomical landmarks seen in IOPA. Thank you.